Hi, I'm Charlie. I have optic atrophy. I've been a patient of Dr. Noon since I was 12 years old. When I was 16, I was not able to get my license like any other kid due to my vision. I had to move to another state so that I could drive with bioptic glasses. Arizona changed the law, so I was able to move back home. I'm a realtor now, so I'm able to drive my clients around. Bioptics have changed my life, and they could change yours too.
Driving is a way of life that many of us take for granted. In January of 2006, Arizona became the 39th state to grant a driver's license to some visually impaired people when they drive using a bioptic telescope. Welcome to Viewfinder. The doctors at Viewfinder Low Vision Resource Centers specialize in low vision optometry. They focus on how their patients function visually in day-to-day activities and help their patients enhance their remaining vision with special low vision eyeglasses and low vision aids. They help their patients perform their daily activities despite a visual impairment so that they can enjoy life and remain independent. Dr. Lynn Noon, founder of Viewfinder Low Vision Resource Centers, is a diplomate in low vision rehabilitation. She was the driving force behind the Arizona Department of Transportation rules change to allow bioptic driving in the state of Arizona. Dr. Robert Canas is the co-founder of Viewfinder. Dr. Kevin Huff also specializes in low vision and has taken a special interest in bioptic driving. Today we want to talk to you about bioptics and driving. The ability to drive is a privilege that many of us take for granted. Being able to drive gives us access to better jobs, to participate more fully in our families' lives, and to decrease the social isolation many low vision adults feel when they cannot leave their home. Bioptics can change that.
Hi, my name is Donna, and I have chronic uveitis. How I feel about my bioptics is incredible. I never thought in a million years, as a low vision person, that I would ever be able to drive. It has changed my life unbelievably. I no longer have to ask for rides or worry about how I'm going to get somewhere. I can take care of myself in case of an emergency now, and that means the world. The people at Viewfinders were so helpful and caring. I live out of town, and they went above and beyond to accommodate my training. They are the best.
What are bioptic telescopes?
Hi, I'm Dr. Bob Canas. I'd like to talk to you about bioptic telescopes. Arizona recently became the latest state to allow driving with a bioptic telescope. One of the major concerns of people with visual impairment is to continue to remain independent. Driving an automobile is one of the major factors allowing a patient to remain independent. A bioptic telescope is a device that will allow a patient to identify street signs, storefront signs, etc. Let me show you how it works. Basically, the patient's best eyeglass prescription is mounted in a spectacle frame. The telescope is this device on top of the spectacle RX. We use this device like a patient would use a telescope for spotting distant subjects. However, we're driving 95% of the time looking through the regular eyeglass prescription. The patient must see the same visual requirements through the telescope as an average sighted person must see in the state that they drive in. That means they must see 20/60 for a daytime restricted license, 20/40 for a full-time license through the telescopic device. They only use this device when they are approaching an intersection or want to see a detail in the distance. They simply drop their chin down, line the telescope up with the target they're trying to see. When they identify the target, be it a street sign or a storefront sign, they lift their chin up and proceed to drive. The best candidates for a bioptic license are people with a stable visual condition, such as albinism or optic nerve atrophy. Other diseases, however, still are candidates. The patient needs a thorough low vision evaluation by a low vision specialist. This will allow the patient and their family to feel comfortable in allowing that patient to drive an automobile safely.
My name is Charles, and my low vision problem is due to a macular hole which involves the retina of my right eye. I have always been able to maintain my driver's license, but approximately 1 year ago I was evaluated by Dr. Noon at Viewfinder, and it became obvious that I was unable to read the visual acuity chart in order to pass the eye test to renew my driver's license. Therefore, she recommended that I would be a good candidate for the bioptic system. After I got my bioptic lenses, I went through several weeks of training by an occupational therapist here at Viewfinder, and when I became able to use my bioptic lenses quite well, I was evaluated again by another occupational therapist who gave me an evaluation driving test behind the wheel, and I passed that with flying colors. I then was able to go to the Department of Motor Vehicles and get my new license.
Hi, my name is Janet, and I have histoplasmosis. I just want to be able to drive myself to the beauty shop and to meet my friends for lunch. And I like shopping by myself and not have to drag my husband along. I got bioptic telescopes after Dr. Noon said I was a good candidate and trained to use them with a therapist. It took me a while to get used to them, but now I love them. The therapist helped me and made sure I was a safe driver. Thank you, Dr. Noon.
My name is Jerome. I lost my driver's license in April of 2006. I have macular degeneration in the right eye, and there's a hole in the retina. I taught defensive driving for AARP for 11 years, so I'm very conscious of the fact that you need to be a good and safe driver on the road. I have to drive because my wife is ill enough that she can't drive herself, and I need to do the shopping and the rest of the things that are necessary with a driver's license. I went to Viewfinders, and Dr. Noon and the occupational therapist said I was a very good candidate for the bioptic lenses. I purchased the lenses. I went through the training with the occupational therapist, got all of the paperwork that was necessary, went to the motor vehicle division, and they gave me a driver's license, and I said I passed with flying colors.
Visual acuity is not the only factor that should be taken into consideration. Cognitive ability, reaction time, and the use of good judgment are equally important. Your evaluation and your eye doctor will determine if you are a candidate for bioptic driving programs. Our doctors conduct a comprehensive exam on every patient, which takes a full hour. They then make recommendations to the patient about what low vision aids will help them. If you have been denied a driver's license and wish to drive, please make an appointment with one of our doctors. During your examination, they will introduce you to bioptic telescopes and determine if you are a candidate for the bioptic telescope driving program. Our goal is to help you become a safe driver. We believe thorough evaluation and proper training is needed to use the device.
A bioptic telescope alone does not make a person a safe driver. All potential drivers require extensive training in the use of their telescope. You will be evaluated and trained by Viewfinder's occupational therapists. The training will focus on the user's ability to use and demonstrate movement in and out of the bioptic within 1 to 2 seconds. Patients will be given a series of exercises to practice at home, including being a passenger in a car. The occupational therapist will instruct you through these series of exercises designed to bring you to a skill level ready to pursue driving. When you've demonstrated the ability to correctly use the bioptic telescope, you're ready for that next step.
Hi, my name is Norman, and I have congenital optic atrophy and optic nerve damage to both eyes. For years, I thought I would never be able to drive a car. I had to use a bus to get to and from work. It took me on average of 2 hours just one way, and it is hot out here. Having to rely on the bus to get to and from work is hard enough, but it really interferes with my social life.
Hi, I'm Jenny Nordine, and I am an occupational therapist. I'm also a certified driving rehabilitation specialist. While Arizona does not require behind-the-wheel training for drivers who have previously driven, your doctor may refer you to a driving rehabilitation program, especially if you have not driven in a period of time. Many lighting, glare, and road conditions influence the ability of the low-vision driver's performance. A driving evaluation and training program will help prepare you for the Arizona Department of Transportation road test and increase your safety and confidence behind the wheel. It is important to have a certified driving rehabilitation specialist who is knowledgeable and trained in the use of bioptics. The driving rehabilitation specialist will then make suggestions to help the patient with their driving skill and develop a training program to help the patient meet the Motor Vehicle Department's criteria to pass the driver's test while using the bioptic telescope.
Now I can drive anywhere I want. After the law was changed, I tested with Viewfinder, learned how to use my bioptic lenses for driving, and then went through the driving training with Driving to Independence. Driving is independence for me.
A bioptic driver must be able to meet the Arizona Department of Transportation visual acuity standards using no more than a 4-power bioptic telescope. Current standards are best covered visual acuity of 20/40 or better for an unrestricted license, corrected visual acuity of 20/40 through 20/60 for a restricted daytime driving license. An eye doctor must determine the visual acuity and fill out the ADOT form. A bioptic driver must have a visual field of at least 70 degrees temporally and 30 degrees nasally. Your eye doctor will test your visual field. A bioptic driver must pass the standard driving test with an Arizona Department of Transportation driving instructor performing all regular driving tasks such as speed control, merging, driving in traffic, and effective use of mirrors. The driver must have an ADOT driver's vision form filled out by their eye doctor on an annual basis. Driving is not only a privilege, but is often seen as a rite of passage for young adults. Persons with diagnoses such as ocular albinism, Stargardt's, optic atrophy may have been told that driving a car was not possible. With bioptics, it can be possible for these young adults. You can imagine the sense of freedom having a driver's license means to someone who has been told they would never drive. Are you a bioptic candidate? We invite you to come make an appointment with one of our doctors to explore the possibilities of bioptics in your life.